I'm going to talk about the first early sign of toxic kidneys. So, the number one early sign of kidney damage is decreased urine output because you're leaking fluid in other places inside your body, in your ankles, in your legs, in your feet, around the eyes, around the hands. So instead of eliminating the urine, it's kind of backing up into the tissues. And so when you urinate, you're not going to see a large output of urine. So that's the number one symptom. But number two, you're going to see frequent urination. Now, frequent urination doesn't necessarily mean large amount of urine coming out when you urinate. It just means that you're urinating frequently, smaller amounts, on top of a lot of retention of fluid throughout the body. So instead of that fluid coming out of you, it's kind of backing up underneath the eyes, on top of the eyes, in the ankles. When you press your finger into the ankle, you'll leave that little dent. It's called pitting edema. Now, some of you are saying, well, isn't that the symptom of liver disease? Well, just think about this. Well, anytime you have a kidney problem, you're also going to have a liver problem. So there's no way you're going to have a very sick liver and a very, very healthy kidney. Both the kidney and the liver work very closely together. And so a lot of the symptoms can cross over. So number one, decreased urine output. Number two, urinary frequency. Number three, ammonia smelling urine, body odor, and breath. Now, ammonia has a very distinct smell, but that ammonia smell is basically just more waste because the kidneys are not able to do their job. When the kidney loses its function in chronic kidney disease, you're losing up to 50% of those little filters called nephrons. So just think about what happens to the toxicity in your body. And so sometimes people think, wow, I'm deficient in protein in my blood. Maybe I need to eat more protein. Well, that never helps. All that's going to do is going to turn into more waste and create more stress on the kidneys. Number four, your urine is foamy. That is an excessive byproduct of protein. It can also occur when you're exercising intensely as well. But if you have foamy urine and you didn't just exercise and you didn't just eat a lot of protein, then potentially it could be the kidney. All right, number five, you're cold all the time. Okay. Now, one of the functions of the kidney is to help create red blood cells. And if you're not able to create red blood cells, you become anemic and you're cold all the time. Number six, itchy skin. Your skin can also be dry as well as itchy. So those two symptoms are indicators that there could be a kidney problem. And number seven, which occurs with so many issues, you're just going to be tired. All right, so now that you know the number one sign of early kidney damage, as well as some of the other signs as well, what can you do about it? So, of course, number one, the most important thing, especially if you're diabetic, is to cut down the carbs, okay? Just cut them way down as low as possible and get your carbs from vegetables, okay? Not from grains, because if you look at chronic kidney disease, one of the recommendations would be, like whole grains, cut back your red meat, cut back your salt. Why would anyone want to add grains? What benefits do grains have on the kidneys? Zero benefits. And number two, you need to give up alcohol completely. If you look up chronic kidney disease, they'll say reduce your alcohol. No, you want to eliminate it. Why? Because you're already in a very fragile state and the kidney is damaged. And just a little bit of alcohol is just going to push you further into the mud. You're really not at a place where you can afford to have even just a little bit. Your diet has to be very, very clean if you want to recover. And the third point I want to bring up is the amount of protein. You don't want to start going no protein. You just want to do a moderate amount of protein, okay? And a high quality protein like eggs or fish or grass-fed, meats, things like that, as compared to protein powders or some protein shake with soy protein isolates. You don't want to do that. And like I said, get your carbs from your vegetables. Have a lot of vegetables, moderate protein.